Okay, welcome everyone. Dr. Linda here. We are going to continue talking about the endocrine system. And in this short video, we will show you the connections between the hypothalamus and what we see right here is the pituitary. And in a previous video, you heard me talk about the pituitary gland, and you heard me say that there was an anterior portion and a posterior portion. You heard me say in another video that the anterior portion was called the adenohypophysis, and you also heard me say that the posterior pituitary is the neurohypophysis. In a previous video, you heard me talk about the connections between the hypothalamus, the pituitary, and the thyroid, as well as the hypothalamus, pituitary, adrenal. In this video, we're going to show you the connections between the hypothalamus, the pituitary, the adrenal gland, the hypothalamus, pituitary, thyroid gland, the hypothalamus, pituitary, the gonadal axis as well. So there's lots to show you here. Let me change the color of my pen to red, and let's erase that. And let's go to red. Now, remember the hypothalamus is below the thalamus, and it's involved in secreting either stimulatory hormones or inhibitory hormones. So it can send a hormone to the pituitary that may be like a thyroid releasing hormone or a thyroid inhibitory hormone. Okay, it's going to send signals to the hypothalamus, and then the hypothalamus is going to send signals to the pituitary, and then the pituitary will relay hormones to these other glands to create different functions. So here we see the adenohypophysis, the anterior pituitary, and we see the neurohypophysis or the posterior lobe. Now remember, the posterior lobe right here is only dealing with primarily these two hormones, ADH and oxytocin. Where was ADH and oxytocin produced? Way up here in the hypothalamus. Remember, it produced it, but it's stored in the posterior pituitary. The posterior pituitary can release antidiuretic hormone, which will have effect on the kidneys. Antidiuretic, not diuretic. Diuretic is going to make the person pee or urinary. Antidiuretic hormone is saying, hey, we got to hold on to water. Okay. Oxytocin is going to affect both the male and the female reproductive tract. In the female reproductive tract, it's going to act on the muscular layer, the thickest layer here of the uterus. Now the uterus has three layers. It has an endometrium, a myometrium, and a epimetrium all the way on the outside. So the endometrium is here on the inside. The epimetrium out here. And then in the middle, the thickest layer is the myometrium, and that's smooth muscle. So oxytocin is going to make the smooth muscle of the uterus contract. In the male reproductive, it's going to make the smooth muscle in the vas deferens or the ductus deferens. It's going to make that contract for ejaculation, as well as the prostate gland. Okay, so that's the posterior lobe. When we look at the anterior lobe is going to release adrenocorticotropic hormone. When we look at the word adrenocorticotropic hormone, we see adreno. Well, that's the A for the adrenal gland. Cortico, the C for cortico. Well, this outer portion of the adrenal gland here, this portion, I'm going to color it in like that. This is the cortex. That's the adrenal cortex. The inner part is the medulla. So adrenocorticotropic hormone, this is going to go to the adrenal cortex, and the cortex is going to release glucocorticoids and mineral corticoids, right? I stress those words to help you remember it. Adrenocorticotropic hormone goes to the cortex of the adrenal gland and pushes out glucocorticoids and mineral corticoids. Whereas the adrenal medulla, the inner portion of it, has different function. And I'll show you the relay to that, okay? But it's not the adrenocorticotropic hormone. You'll see that, let me erase this for a second. You will see that inside here, the adrenal medulla, it's being stimulated directly by the nervous system. You have this long preganglionic neuron that's going to insert right at the adrenal medulla, and it's going to push out the adrenaline and noradrenaline, or epinephrine and norepinephrine, and those are called catecholamines. Okay, you can see them here. Glucocorticoids like cortisol, corticosterone, cortisone. All right, so I'm going to go into more detail on the adrenal gland in a separate video, but here's a nice introduction to it. Okay, what else? The hypothalamus is going to send a hormone called thyroid releasing hormone. We can call that TRH, thyroid releasing hormone. And it's going to go to the anterior pituitary. Then the anterior pituitary releases thyroid stimulating hormone. And up here on the upper right, you can see all the abbreviations there, right? So TSH is thyroid stimulating hormone. ACTH was adrenocorticotropic hormone. So thyroid stimulating hormone goes and it's going to hit a receptor here on the thyroid gland, and it's going to say, okay, you're going to release T4. And then remember, T4 can get converted to T3. Where did I say most of that conversion takes place? In our good friend, the liver. And we said it is selenium dependent. Some conversion does take place in the thyroid, but most takes place in the liver. Now, T4, the T is for tyrosine, and the 4 is for how many iodines are going to attach to it. So it's 4 iodines. They call that thyroxine. Then we have T3, which is tyrosine with 3 iodines. That's called triiodothyronine. Triiodothyronine. GH, growth hormone. Well, that's going to go to the liver. The liver will produce somatomedins, and that's going to be involved in growth and regeneration and repair of bones, muscles, ligaments, tendons. It's going to make you grow. It's released when you sleep. That's why babies nap so often, and we see how quickly they grow. We know athletes like to take naps throughout the daytime for an extra burst of growth hormone to make their muscles regenerate and repair. Okay? Prolactin. So the hypothalamus will release prolactin releasing hormone. It goes to the pituitary. The pituitary releases prolactin, prolactation. It helps the mammary glands in producing milk. Then we have FSH and LH. You can see FSH right here is follicular stimulating hormone, and then LH is luteinizing hormone. LH is what women check in their urine with a dipstick when they're trying to plan a pregnancy. LH spikes high at time of ovulation. Ovulation means that right here, the ovary pushed out an egg, and it pushed out an egg here into the fallopian tubes. Okay, when the ovary kicks out and pushes out the egg, that's ovulation. And that happens when luteinizing hormone spikes. Okay, so a woman may check the urine and go, oh my gosh, my luteinizing hormone, it's spiking. And she will only have like a 24-hour window, maybe a little bit more for conception. Okay, and FSH works in conjunction with LH. They both work together. So FSH is going to affect both the male, reproductive, and FSH will also affect the female, reproductive tract. FSH is involved in producing the sperm in the male, and follicle stimulating hormone in the female is designed to help produce the eggs. Okay? And then MSH, melanocyte stimulating hormone, they don't know too much about it. They think it may have some effect in the brain, but it's also involved in darkening the skin. Okay? So to review here, right, growth hormone, we see that it stimulates the liver, the muscle, cartilage, bone, and other tissues to synthesize and secrete these insulin-like growth hormone factors, which promote growth of body tissues. Okay, growth hormone also targets cells to help lipolysis, which is fat breakdown, and decrease glucose uptake. Your thyroid gland stimulates the synthesis and secretion of thyroid hormone. The ovaries and testes, well, in the female, it initiates the development of the egg, which is the oocyte. In the male, it stimulates the testes to produce the sperm. So in female, it initiates the development of the egg, and it's involved in secreting estrogen. In males, the follicular stimulating hormones is going to stimulate the testes. The testes will, in effect, produce sperm. That's the FSH. The luteinizing hormone is going to stimulate in the female the secretion of the estrogen and progesterone, ovulation, and the formation of the corpus luteum. Okay, and in the male, it's going to stimulate the testes to produce testosterone. We talked about prolactin, that's for or promoting milk production in the mammary gland. Here's the adrenal gland. Here's the adrenal cortex. It's involved in producing glucocorticoids, mainly cortisol, cortisone, corticosterone. And in the inside is the adrenal medulla, and we'll talk about that in another short video. And then here's melanocyte stimulating hormone. They're not quite sure. They think it's involved in some brain activity. And when it's there in excess, it can cause the skin to darken. Here's our oxytocin. It's going to stimulate the smooth muscle cell of the uterus. We call that the myometrium. It's going to stimulate the contraction of that. And it's also involved in helping the mammary glands of the breast to eject milk. The ADH is going to be involved with the kidneys and the sweat glands and your blood vessels. And its primary job is to conserve body water by decreasing urine volume, decreasing water loss through sweating, and it raises blood pressure by constricting the arterioles. When we come back, I'm going to get into positive and negative feedback loops.